We can go ahead and get started, William. On you.
Perfect. Hello, everyone, and welcome to today's session on Kickoff of Pride and Rare, the EveryLife Foundation's new program. We are so excited to have all of you here. And I think I'm speaking for everyone on the panel when I say we've just been so excited for today's event. So we can go ahead and get started with a little bit of a welcoming. So I just wanted to welcome everyone and talk a little bit about what my connection is to the community, as well as um, a little bit about this program. So, my name is William Romero, and I am a rare disease patient. I have a rare disease called fibrous dysplasia, and I've been involved with EveryLife for the past 2 to 3 years through the YAR leadership program initially. Um, and just this past year, I spoke on Capitol Hill for the Rare Disease Week with a diversity discussion where I talked about how I combined my drag with my disability activism in the form of Daisy-Bility, and kind of talked a little bit about the intersection between rare disease and LGBTQ plus identities. Because as many of us know, people who are affected by a rare disease and belong to additional marginalized communities are more likely to experience increased and more complex stigmatization due to the intersectionality of these identities. And so, for example, the LGBTQIA plus population may lack access to safe spaces, involvement in policy legislative efforts, and opportunities to participate in advocacy events. As a result, there is limited data, awareness, and proposed policy solutions that could be used to remove these barriers, address these gaps, and improve the lives of diverse rare disease patients. So, this type of program is to hopefully try to fill that little bit of a gap. And since Rare Disease Week and since speaking on Capitol Hill, I've been preparing for a global fellowship where I'll be researching the intersection of drag and public policy on a global scale. So I'll be starting in Japan in August. So if anyone has any recommendations, reach out to me about drag around the world. But we can go ahead and get all of this started. I'm so excited to introduce to you all the speakers who we'll be having for today's event. So first, we're going to start with an introduction to Pride and Rare by Priscilla Rodriguez. Priscilla Rodriguez is the Diversity Inclusion Advocacy Manager at the EveryLife Foundation for Rare Diseases, who has been working with community members to officially launch EveryLife Foundation's LGBTQIA plus rare disease program. Following Priscilla, we're going to have a section by Carter, who is going to talk about the 2023 LGBTQIA plus rare disease initiative. Carter Hemion, Dehi, is a 2022 YAR Leadership Academy member, one of my fellows, and an LGBTQIA plus rare disease initiative facilitator. They are a YAR member and a rare disease advocate living with classical Ehlers-Danlos syndrome and its comorbidities. They participate in federal and state legislative advocacy with a focus on the intersection of rare disease and LGBTQIA plus experiences. Following Carter, we'll have a little section by Courtney, who's going to talk about the YAR healthcare guide. Courtney Felle, she, they, is the Young Adult Rare Representatives Program Manager at the EveryLife Foundation for Rare Diseases. Following their own diagnostic odyssey with a rare intersex variation, Courtney is motivated to support all emerging advocates affected by undiagnosed, misunderstood, and stigmatized conditions. And then we're going to have Katrina Byrd share their advocate's personal story. Katrina, she, her, is an RDLA and ALS Hope Foundation advocate. They are a Mississippi native and is a writer who lost their partner of 23 years, Dora, to ALS. And then we're going to talk a little bit about what Daisy's been up to with a little bit of celebrating the intersection of pride and rare disease. So if you would like to get us started off, Priscilla, we'd love to hear the introduction to Pride and Rare.
Absolutely. Thank you, William. Thank you all for being here today. Let me start by saying happy Pride. I know this and you know this. It is the official Pride Month, but every month is actually Pride Month and you are loved. So let's hop right in. I'm here to talk about the reason for the season, which is the official launch of EveryLife Foundation's Pride and Rare program. This is something that we have been working on for the past year and a half now, and we've really been engaging in a space to better understand the intersectionality of LGBTQIA plus identity and rare disease identity. So this included brainstorming and holding a series of focus groups and actually doing a soft launch of an LGBTQ rare disease initiative that was led by our very own, that's on the call today, Carter, as well as holding monthly meetings. And from these conversations and these focus groups that we were having, we finally felt like we were in a space where we had enough information to launch this incredible initiative to the broader public, hence Pride and Rare. So what you'll see here is the official landing page of our Pride and Rare program. I am so excited to see this evolve and be built from the ground up by the community, for the community. And you'll see the link to this website dropped in the chat briefly. And I can go the whole night talking about this webpage and how we can continue to build this up together. But I'm just gonna point out some key parts, ways to get involved. You're already doing it. You're on this call. You're already getting involved. You're part of this kickoff event. You're getting started. It also includes attending community forums as we begin to host community forums, community discussions as we build out our policy priorities. It's sharing your story, whether that's using the link on our EveryLife Foundation website or sharing your story with somebody who may not know your story or may know your rare disease story, but doesn't know your whole story. It's also taking the first of its kind Pride and Rare survey that is now out, which will also be dropping in the chat shortly, taking time to continue to expand on what we've been doing for the past year and a half. We've heard experiences, we've heard about the resource gaps that exist, we know about the resources that exist, and we want to continue to build and expand on those opportunities. And this survey is continuing to build on what we've been building for the past year. Advocacy resources. We, again, as a community, are going to come together and we're going to build out what these advocacy resources are going to look like. We're going to work together to build toolkits, have listening sessions, engage with providers. Those listening sessions are really you telling us what you as a community need. And then policy priorities. Like I said, we're building this together. We're going to have conversations to determine what our policy priorities are, how we plan to engage, and what we would like to see Pride and Rare actually be. So you can see my common theme of coming together. For the LGBTQIA plus rare disease soft launch, we utilized Discord. For those who don't know what Discord is, it's an app that you can utilize, or a website where you can have conversations with other folks in the community and share your stories and share opportunities or events that are happening. I am happy to say that that was a success in the soft launch, so it is officially going to be a part of our Pride and Rare program. So we will have both a Discord channel as well as a Facebook group. So if you don't feel comfortable using Discord, Facebook page is right there to have your back. So stay tuned for more information on these two social channels. This is the opportunity to come with friends or meet new friends and engage in discussion and celebrate what we're here for, and that's the LGBTQ rare disease community. So a little bit about the program. There are a lot of goals that we hope to achieve and we will achieve with this program, but I specifically want to point out three. The first one being celebrating diversity and just acknowledging and supporting the unique challenges that we know exist at the intersectionality of LGBTQIA plus identity and rare disease identity, as well as multiple marginalized representation that may not be able to identify as LGBTQ or rare. We want to foster community, just like we're doing today. We're providing platforms for research sharing and discussions on issues that are impacting this community. And then ultimately, we want to advocate for change. We want to unite and drive legislative and create educational initiatives that impact our community. So what can you do? Like I said, you've already taken the first step. You are part of today's kickoff event. You're a part of the first ever Pride and Rare program. So keep doing just that. Keep doing you. Continue to engage in our events that help us shape our policy initiatives or our advocacy resources, or just engage with community members at upcoming programs or events. You can contribute by participating in surveys like the Pride and Rare survey that's currently open. And what that does is that really helps us track trends and expand our toolkits of resources. I've had conversations with many folks, a lot of folks on this call, and I always say, if you do a quick Google search of the LGBTQIA plus rare disease resources that exists out there, especially as it relates to research, you're lucky if you find a handful of them. Let's start that today. Let's let this survey be the starting point for that data. And promotion. Help us disseminate the information about our community, for our community, talk about events as well as opportunities that are approaching. We all know that this issue exists. We all know that this gap has long lived for as long as we can remember. And there are a number of issues that I can touch on, but I'm going to stick to this slide here, with the most pressing one being healthcare discrimination. We know LGBTQ individuals are twice as likely to encounter negative experiences in healthcare settings. We know the mental health needs associated with identifying as LGBTQ and as rare. We know there's limited resources, and we know that there's a need for support. At the end of 2023, we released a Community Congress survey. Community Congress is another one of EveryLife Foundation's programs, and we asked patient advocacy organizations if they were interested in providing resources to this community and working in this space. And 16% actually said that they offer specific resources to the community, and 40% said that they want to offer support to the LGBTQ rare community, but they weren't sure where to begin or where to find those necessary resources. So that's what we can do together. We can build these resources so these advocacy organizations and other organizations that may have not taken the survey have those readily accessible. And again, I am going to keep coming back to this. Our Pride and Rare survey is now open. This is the first of its kind. We're expanding on the soft launch. We need you. We need your experience. We need your expertise to make this survey a success. And what this survey does is it gauges your experience as it relates to healthcare and therapy access. It examines resources that are available or resources that may not be available that we together can create. And it helps us decide how we're going to continue to build out our Pride and Rare policy priorities. So you can find that link in the chat. And lastly, I just want to give a big thank you to everybody who helped make this Pride and Rare program a success in terms of its launch, from the brainstorming to the focus groups, to the soft launch, to the monthly meetups, to all of the logistics that people have put into getting the webpage up and running, to hosting today's event. Thank you for making this possible. And thank you to everybody on this call for making this possible. This wouldn't be here if it weren't for your feedback and it weren't for your engagement and your enthusiasm about making this a reality. So to everybody on this call, thank you. Let's continue to make noise. Let's make some change, and let's come together for the LGBTQ rare community, because we are just getting started.
Thank you so much, Priscilla. I think I speak for everyone when I say thank you. We appreciate all the work that you've done in this space, and the website looks amazing. Everyone should go check it out. It's everylife.org/pride pride-in-rare. So please go check it out. The link is in the chat. And please do the survey as well. Our next panelist is Carter, who will be talking about their experience so far in this community and with the soft launch. And I'm very excited to see what they have to say. So here we go, Carter.
Thank you, William. I'm just so grateful to be here and to get to share this community with you all. This has been really exciting, and I'm just so glad we get to share it today. I want to share part of my story and why this community really matters to me, and then a little bit about the work that I've been involved with here the last year. I've found a lot of relief and comfort in finding words to better understand myself and my experiences and to be able to connect with community. And for me, some of those words include classical Ehlers-Danlos syndrome and non-binary. I started coming out as queer when I was 13, so about 10 years ago now. And I had a really long diagnostic odyssey to learn about my connective tissue disorder and the comorbidities it comes with. And so for me, I was out before I started getting diagnosed. In the transgender community, it's really common to experience medical discrimination, where healthcare providers assume our symptoms are directly related to our gender. So when we come into a clinic with any kind of symptom or condition, some healthcare providers will end up jumping first to the assumption that any health problems have to do with our gender identity, our lifestyle, potential gender affirming healthcare treatments, even if we're not pursuing any. And instead of looking for the underlying issues, treating us like any other patient, and get fixated on our identity as a source of trouble. And I've experienced this, especially earlier on in my diagnostic odyssey, with coming in with chronic pain, allergic reactions, dystonia, hearing changes. And I just can't count the stories I've heard from other transgender friends who've had similar experiences of prejudice delaying their access to accurate diagnosis and their access to treatment. In my case, I ended up actually getting misdiagnosed with a personality disorder because I ended up at a clinic where my doctors thought a lot of my symptoms were because I was attention seeking and because of an issue with identity to do with my gender and not actually referring out to specialists or doing tests and screenings for any common or rare health conditions. And that a lot of the advice I got worsened my health and delayed my access to treatments. And I still haven't fully recovered with my health since then because of the ways that it put me backwards. And when I did finally find a better care team and getting properly diagnosed, my rare diseases then started complicated gender affirming care. So once I started hormones, I then had to stop to deal with some of the complications from my rare diseases, and then ended up complicating and making me step back on that. And another example of the intersection experiences with surgical procedures, where on one side I have to make sure we go through all the special wound care considerations and anesthesia considerations, but I also have to make sure my anesthesiologists know what name I go by, because I've been going by my chosen name for about 9 years. But if they try to call me by my legal name, I probably won't respond and wake up to it. So there's a lot of these little things that we all have to juggle and figure out with these extra challenges to healthcare. As a patient, I sometimes have to make the really difficult choice between the specialist who understands or is willing to learn about my rare disease and the specialist who understands or is willing to understand my experiences and my needs as a queer and transgender patient. This has been especially an issue when it comes to finding specialists for reproductive health care or care with pelvic floor muscle problems related to my rare disease. The discussions I've had to have around sexual orientation and relationship history. And while navigating these unique challenges of being queer and trans with a rare disease, I started meeting other people in the community who had these similar experiences, and getting to talk about it with each other has been really beneficial to navigate this journey. We have a really unique experience in that we all usually have limited specialists available who can manage these rare diseases and who have the knowledge about it. So coming out can really impact our relationship with healthcare providers, because if it doesn't go well, that can totally jeopardize our access to equitable care and affect the kind of treatment we get. This is especially relevant for our community members who are also facing barriers accessing culturally competent care, mental health care, trauma-informed care, care in their native language, care for other acute or chronic health conditions, and the other layers of marginalization that a lot of people experience. As rare disease patients and people with these chronic and complex health conditions, we tend to get referred around a lot to different healthcare providers across different clinics, different healthcare systems, different specialties. And something I've noticed in my experience and the stories that I regularly hear from others is that there's no real standard to expect for how we might be treated. When I go to a new clinic or even to a new specialist at a familiar clinic, I dread those awkward conversations explaining what name I go by, what pronouns I use, why my referral or my chart might have a mix-up between those, or not have said anything, or have said it in a weird way. and that I don't want to discuss my gender or sexual orientation in detail, and I'm here because of the symptoms, not because of that. And those conversations end up taking time out of the sometimes very short appointments we get with our specialists. The same way having to go in and re-explain a complex rare disease history in our presentation to a new provider takes away from that limited time we have with our specialists. Sometimes with rare disease, the wait can be months or even a year to get in with our doctors, and losing that time and energy costs a lot for us. Encounters with homophobia, transphobia, intersexism, other anti-LGBTQIA plus stigma can be uncomfortable at best, and at worst dangerous and traumatizing for patients. In an ideal interaction, our healthcare providers are going to be informed on or willing to learn about LGBTQIA plus and rare disease experiences and able to provide that inclusive care. But sometimes we still keep running into the healthcare professionals who instead let bias interfere with our care and make inaccurate judgments and get more focused on our identity than our symptoms. So when EveryLife started having conversations about this intersection, I was really, really excited to get to be part of a focus group and to be in some of these discussions about community priorities. Most of the past conversations I've had have been with people who I just happened to meet in the community and where we got comfortable enough knowing each other to talk a little bit about it. But I'd never really seen a meeting like this organized to bring people together to be able to have these productive conversations about our needs, about our experiences, what we want our community's future to really look like. And realizing then that we didn't have consistent real-time spaces to continue those connections, I reached out for some support and starting a regular Zoom group. Since October, we've successfully held monthly meetings to give our community a space to meet each other, make connections, ask for and share resources, exchange advice, and really identify some of our community priorities as we build new resources and new spaces for LGBTQIA+ and questioning people within the rare disease community. I've heard a lot of similar stories like mine and stories that have brought things to my attention that I totally didn't know about. Things like the challenges people face coming out to their family or to their caregivers while facing health difficulties, discussions about managing emotional capacity for interpersonal conflict when there's a misunderstanding of rare disease or about identity, rare communities where patients often can't access gender-affirming care because the priority is managing life-threatening complications from their disease, issues where all the drugs for a diagnosis or treatment interact with birth control or other kinds of medications that are important to a patient, and just in general, a real lack of research and a lack of resources specifically for LGBTQIA+ affirming care in rare disease. I suspect as we grow with more resources and more community engagement moving forward, the way the monthly group functions and the kinds of discussions we have will keep growing with us. So I'm really excited to continue being part of this and meeting new community members to discuss the topics that really matter to all of you. During one of our meetings, it came up that people wanted a way to stay connected outside them. So we ended up deciding to create a Discord server as part of the soft launch to stay in touch. This was a space where people had an opportunity to share about their advocacy, to ask questions to each other, to share their events, their ideas, anything that they wanted to talk about. And more importantly, it was a space where people could comfortably connect outside of our real-time meetings. EveryLife is in the process of announcing a new Discord, a new Facebook group, so stay tuned by following EveryLife on social media or signing up for the newsletter so that you'll know when it's announced. Another thing in this group is that we've been both able to identify some of the existing resources coming from the rare disease, disability, and LGBTQIA+ communities, but we've also been able to identify a lot of gaps. This looks like things that we need, like resources specifically for this intersection, places to connect with each other, kinds of resources and fillable templates that we can then share with our healthcare providers about our needs, educational materials both for the wider rare disease community and educational materials for our healthcare providers, more prevalence data about our community, and really just more additional research on the experiences and the gaps in diagnosis and the gaps in care and the needs that the LGBTQIA+ rare disease patients experience. Coming from a legislative advocacy perspective here, we've noticed some shared policy areas where our communities can support each other. Like Priscilla mentioned earlier, insurance and healthcare non-discrimination issues are really important, similar with access to care across state lines, and there's other shared concerns that we've been finding. And these are really the kinds of issues where communities and the people like us at the intersection of both can really work together to make healthcare more accessible and more inclusive for more people. As we've been having these conversations, I've been really energized and excited to be able to continue collaborating and to continue inviting more people like you into these conversations as we work together on the issues that affect our quality of life at this intersection. Learning that there's more people like me in the rare disease community and in the LGBTQIA plus community, and being able to connect has brought a lot of new strength, joy, and friendship into my life. And so I choose to be visible with my diagnoses, my identities, because I found a lot of love in both communities, and especially where they meet. That has made my journey so much easier. We've learned a lot over the last year discussions, and I feel so lucky to get to be part of this thoughtful, creative, and collaborative group of people. So I'm really looking forward to the future conversations we have and getting to watch the Pride and Rare program grow moving forward. Thank you so much for being here. I'll pass this back to William.
Thank you so much. I think that was so relatable about the community and how much easier everything is whenever we do have a Pride community within this space. So could not relate more. And thank you so much for the soft launching stuff in the Discord and the great presentation. Next, we're going to have Courtney come talk a little bit about the YAR healthcare guide. So take it away, Courtney.
Thank you so much, William. I feel stressed to follow up Carter, who always has such powerful vulnerability and has done such wonderful advocacy around this intersection. As my introduction sort of stated, I'm both the Young Adult Rare Representatives, or YAR program manager, seeing some friendly YAR Leadership Academy graduate faces on the panel today, and also a rare disease patient who's part of the LGBTQIA plus community myself. I'm one of the extra rare folks whose rare disease actually puts me itself in the LGBTQIA plus community. I have a rare intersex variation. This is the first time I officially get to say that on an EveryLife call with a recent diagnosis. And I feel like I should be more nervous, but mostly I'm just excited. This is about halfway through the call, and I'm going to also encourage everyone as we talk to just do a little wiggle, put things in the chat as you resonate with different things that the panelists are saying. I have my fun Chile earrings on for this. It's Pride. We're celebrating the kickoff of Pride and Rare, and we've all needed this for a long time. So with all of that, I'll take us into the next slide and talk about one example of a resource that the EveryLife Foundation has put out that is useful for this LGBTQIA plus rare community, and a good example of the kinds of resources that we can develop more. In September of 2022, we put out the YAR healthcare guide. This was originally conceptualized through our YAR program, and it emerged from members in real time in our monthly General Assembly meetings, talking about being young adults, struggling with the transition from pediatric to adult healthcare. There's a ton of policy and regulatory barriers that go into that transition. It can be really difficult to be an individual, especially a marginalized individual, navigating that system. And folks really wanted more information on how they could advocate for themselves as their full selves, rare disease patients, often multiply marginalized or LGBTQIA plus rare disease patients in that process. So this was a very collaborative way of building the healthcare guide. Some of the folks actually who are here today helped with some of those focus groups and that creation. There are some lovely quotes from young adult advocates that I encourage you all to check out in the link that Shannon shared in the chat, which is the fuller healthcare guide. And this is what emerged. This is the homepage of the YAR healthcare guide, where you can see some of the icons and some of the questions that we were asking. That sense of being by, for, and from the community was really important to us. Patients are the experts on what it is like on a day-to-day basis to live within the healthcare system, within the wider world of being a rare disease patient. And that also means we know what questions to ask, we know what we want answers to, and we know where a lot of those gaps are, where there aren't clear answers yet. So if we can move to the next slide. Part of where this really overlaps with that intersection of the LGBTQIA plus community really hits home for me in this quote from Amelia Williams, who is the YAR member featured on the homepage of the YAR Healthcare Guide. She says, as a young adult patient, it is easy to get lost in all the complex details of the medical system. I have found the best way to navigate my health conditions and receive optimal medical care is to be an active member of my care team. Advocating for myself and using my voice in decision-making about my care ensures that I have control over my own body, that I understand what is happening to me, and that I am empowered to make educated decisions when faced with choices that will have major impacts on my quality of life. And I really wanted to underscore right in the middle of this quote what Amelia says about having control over your own body. That's a thing that can feel really difficult, especially when you're newly diagnosed with a rare disease or any chronic illness. It can also be really difficult as an LGBTQIA plus person in this society. And it can be really difficult at that overlap of both being LGBTQIA plus and having a rare disease. But that also means that self-advocacy and having the tools and support and policy changes that empower your advocacy is extra important. That ensuring that you have control over all the facets of your body and your life has added meaning and added power for us in the LGBTQIA plus rare community. And that's where tools and resources like what the Pride in Rare program can provide come in. That it helps to support you in figuring out how to phrase that self-advocacy, how to push for change on a larger policy, regulatory, and societal level. So if we can move to the next slide, one of the examples that was really important for us to include in this YAR Healthcare Guide is a section in the final sort of bullet point of the YAR Healthcare Guide, and it's how to navigate healthcare as a rare disease patient who belongs to additional marginalized communities, which would, of course, include that intersection of being both part of the LGBTQIA plus community and part of the rare disease community. I think we all understand that there are added barriers that come with belonging to that intersection. There are some things that are more difficult. The barriers that maybe we all face as rare disease patients are exacerbated. There are also distinct angles and distinct ways that barriers can emerge. Things like Carter was talking about, where maybe there are only so many specialists for your condition, but the one who really understands your condition does not understand LGBTQIA plus identity. And that's something that us in that LGBTQIA plus rare community really have to deal with the specific disparities of. So we wanted to include some information on that to really highlight that, make sure people are aware of that, and also that we're starting to have a conversation about what we in this community can do to support each other and ourselves in addressing those barriers. So this talks about building an effective and communicative care team that we all deserve, trying to find providers who can give us the type of healthcare that really meets us where we are as patients and people. This also links back to some of the patient groups and resources in our overall Rare Diversity Hub, and now, of course, that will develop from the Pride in Rare program. And if we go to the next slide, this section also continues to talk about some of the data gaps and issues that we're still trying to alleviate in the rare community. A really good example here for the folks in this launch webinar is, say that you are a transgender young adult with a rare disease. Some of those resources and research on the statistical overlap of the fact that folks who are transgender are more likely to have rare diseases or chronic illnesses. That's the type of thing that we really need more research on, more understanding of, standards of care that are based around that. How can you figure out bringing that into your providers, having support from other folks in the community to really see that fuller picture, contextualize the larger community that we're all part of. So that is the kind of resource that the YAR Healthcare Guide begins to set up and that we envision for the Pride and Rare program. And like Priscilla was saying, we really want to hear from all of you directly on what the barriers that you face are, what your needs are, and what your understandings of being part of this intersectional LGBTQIA plus rare community, what all of this is like. So if you fill out the Pride and Rare survey, that is a really great way to share some of that feedback directly with us. And there will continue to be iterative ways to get involved, to share your story, to empower yourself, to empower support others in this LGBTQIA plus rare overlap. So many folks today are sharing pieces of their story that for so long have gone unheard and underserved. And it is really our time now during Pride Month, forever, like Priscilla said, it is Pride all of the time. We are all here together, and we will keep pushing to get what we deserve. So with all of that, I am going to pass it to Katrina to share one of the stories that I'm really excited and honored to hear, and that I hope all of you will also be honored to hear.
Thank you so much, Courtney, and thank you to all of the YARs who helped with the YAR healthcare guide. I'll now pass it on to Katrina, who's going to talk about their personal story living at the intersection of LGBTQIA plus and rare disease identity.
Thank you so much, William. We're having some rough weather here in Mississippi, and so I will keep my camera off so that hopefully there won't be any interruption as I speak. So thank you so much, and thank you everyone for being here. Diagnosed with amyotrophic lateral sclerosis, ALS, November 18th, 2019, Dora, my partner of 23 years, passed away 76 days later on February 2nd, 2020. With no family support, no money, and no legal ties to one another, we navigated the 100% fatal disease alone. We were given a death sentence. We were not referred to an ALS clinic. Clinical trials were not discussed. She was not offered the option to donate her spinal cord to research. As an organ donor and a person who grew her hair for wigs for cancer survivors, Dora would have been happy to donate her spinal cord to research. We had no voice in the disease days. We followed instructions, but never received anything that helped us. Home health wanted to come at their convenience. The nurse asked to come at 7 a.m. one morning. I told her she was welcome to come at 7 a.m., but our house doesn't open until 9 a.m. When home health did come, they didn't do anything. Dora's family wanted her alive, but they didn't want to take care of her. They would rather put her in a nursing home than for her to stay with me in our home. In 2019, Dora was admitted into the hospital on Christmas Eve. Dora was admitted into the hospital on Christmas Eve. Her sister dropped by for a visit the day after Christmas, and her sister became very angry with me for rejecting her Christmas gift, that she called me the N-word in front of the nursing staff. For 76 days, I cared for Dora alone. 76 days of slow, calculated steps to the bathroom. 76 days of struggling to breathe. 76 days of doctor's appointments. 76 days of managing feeding tube, breathing machines, and 76 days of overproduction of saliva with a paralyzed swallowing muscle. Our life together. Dora and I met in 1997 as we worked as AmeriCorps volunteers in an inner city neighborhood here in Jackson. She was white and 25 years my senior, and I am, for those who don't know, Black. We were an interracial, same-sex couple with a 25-year age difference living in Mississippi. That relationship probably would never work. We were inseparable. Our life was hot tea on the front porch, gardening and reading. We were struggling to pay bills, hardworking and hopeful in a world that didn't care about us. We were compassionate to others, always caring for somebody, and always serving. We were laughter, dreamers, and adventurous. We were Perry Mason fans, beer and wine drinkers, and cigar smokers. We were inclusive, avid learners, and animal lovers. We were love. Life without Dora, hard, lonely, hell. Something inside of me knew if my life ended because of Dora's death, it would not honor her, it would not honor me, and it would not honor our life together. My ALS advocacy started 4 weeks after her death. 4 years of telling our story on page and on stage, of traveling, of going to Capitol Hill, of delving into spirituality, of losing old relationships, and of building new ones. 4 years of losing new friends to ALS, of gut-wrenching pain, of coming up with creative ways to make our life matter. 4 years of asking why. What did I do wrong, and why couldn't I stop it? Dora and I were never involved in Pride events. This is my first Pride event. Until her funeral, only a few people knew that we were a couple. We were afraid to be open with our relationship, afraid of taking up space, of being criticized, gaslighted, bullied by the very people we helped. We were afraid of being that grape juice stain on the white blouse. As I sat at the back of her funeral, at her family's request, I vowed to raise my voice to create awareness of this 100% fatal disease. As I advocate for all, I don't feel that what I advocate for will actualize for people who have been systemically devalued. 6,000 people are diagnosed with ALS each year. 70%, 78% white, 22% people of color, 9% Black. Veterans are more than twice as likely to receive an ALS diagnosis. Nobody told me that I would pray to die after Dora's death. Nobody told me I would advocate for the 100% and still not move the needle for people like me and Dora, poor, hardworking, intelligent, systemically devalued. Nobody told me that in the community of the dying and the brokenhearted, I would give compassion and value to everyone's pain. Nobody told me that I would hold my head up during devastating financial situations, unclean drinking water, and living in a city with poor transportation and poor infrastructure. Nobody told me these things. I had to find them out on my own. Thank you so much. And I pass it back to William.
Thank you so much, Katrina, for sharing your story. And I know we're all thankful to have you for your first Pride event. And this is what Pride is all about. So thank you so much. So now I can talk a little bit about Daisy. Daisy is my drag persona that I use to advocate for the intersection of rare disease and my LGBTQ plus identity. So I wanted to provide a little update on Daisy since the DC conference because she's been a little busy. As we can see on the left with my little hat on, I just graduated a few weeks ago from Vanderbilt. So I was very excited about that. And we had like a Pride graduation. And so, of course, I had to go as Daisy because Daisy needs to walk the stage too. And so that was very exciting and also like full circle moment because who would have known? Because 4 years ago, I would have not have told anyone my identity. And now I'm in full drag. Getting my diploma. So that was so exciting. And right now I'm using Daisy for that fellowship that I was talking about just a little bit earlier. I am currently preparing to travel the world and look at the intersection of drag queens and policy, since this is what I'm so passionate about. So if you have any drag recommendations or travel recommendations, I would love that. And also, it's just so surreal because right now I am actually at my drag table where Daisy was born. So I have like my glue stick and like all my wigs. So it's just like really full circle to be able to be here today and be able to be where Daisy was born and be able to speak on this intersection, because it really is something that is so important. And like Katrina and like all of our panelists today talked about, the LGBTQIA plus community is just one of many marginalized communities that doesn't get a lot of attention in the rare disease community. So my hope is that this Pride and Rare program can help start to provide resources so we don't have to do it on our own, that we have a community, that we're able to do it together, that we're able to lean on each other, and we're able to also celebrate our struggles and celebrate the things that we're proud of, because that's what Pride is all about. Pride is a protest, and I think it's important to remember that and remember the activism that is inherent in Pride. And so I'm so glad we can all be here today to advocate for that. And I'm so glad I could share Daisy with all of you. And I hope to continue doing that. So now I think we have a little bit of time for a Q&A if anyone had any questions, or yeah. Yes.
We have
Okay.
about 5 minutes for Q&A.
Perfect. So if anyone has any questions for any of our panelists, we would be happy to take them. So I have a question for Carter that we can start out with. So as policy and advocacy efforts continue, how can we ensure that the LGBTQIA rare disease community's voice is heard?
Thank you, William. I think as we focus on these conversations, it's important to remember that it's not just about the small group of us talking about it and having these conversations within ourselves, but remember with rare disease, as we already know, that we're stronger together. This is something where we need to be represented in more rare spaces and more advocacy spaces, and we need to be able to really both come together with resources we make and to be able to share them with the wider rare community and with the wider disability community and LGBTQIA plus community about rare disease. These things can't happen by just one or two people speaking up and talking in a room together. They happen by coming together and supporting each other, especially where these policy areas overlap when we're fighting for things like non-discrimination in healthcare. So I think that's one of the really important things, is outside of just being represented in these spaces, getting to collaborate with each other and people who are maybe not in both communities all the time.
Thank you so much, Carter. Now I have a question for Katrina. Can you think of one resource you wish you had as a caregiver and LGBTQIA plus rare disease advocate that could be a great resource for others today? I think your mic's muted.
All right, is that better? Okay.
Yes.
All right. I wish that we would have had, I guess, support, a community support. We didn't, we were not out, and we were still scared, even with her being sick and us being together for 23 years. So there was nobody to really talk to about what we were going through. And being in this community lets me know how important that is, having just some support. So I wish we had support groups like this.
Well, we are so thankful to have you. And is Courtney here for a question? Hey,
I
Courtney.
am. I was trying to stay off camera for Carter and Katrina, but I am indeed here.
So, in the Your Healthcare Guide, are there templates available for patients who aren't sure where to begin navigating healthcare as a young adult with a rare disease?
So there are two. This is one of my personal favorite parts of the healthcare guide. So I feel like I planted you to ask this. I actually did not. But there is one on preparing for your appointments. I use this a lot. I'm actually about to use it for a neurologist appointment that I have next week. So I can personally verify that these are useful. And then there's another one as well on planning for your medical records overall, what sort of information to keep available for yourself. And that can be extra important if you are navigating that overlap. Say you're keeping track of gender affirming healthcare if you're transgender, as well as your rare disease. Having really well established records, understanding how all of those appointments are organized. It's a lot. It could be a full-time job to manage all of that. So keeping track of that, having something to help you figure out what questions to ask, what information to bring in, how to be prepared to self-advocate can be really important. So I highly recommend people look at the healthcare guide that Shannon linked earlier. The templates are in parts 2 and 3. You'll see there's a button that has those PDFs.
Perfect. Thank you so much, Courtney. So Katrina, I have another question for you. Um, Considering your experience, what advice would you give to anyone who may have been through a similar situation?
To get to reach out and talk to people. I She died at the beginning of the pandemic, so we were already isolated maybe a year before, and then with her gone, I was more isolated and just didn't know who to reach out to or what to say. So I would say reach out. And I don't know how to tell you to do it, but I'm happy to be a part of all of these resources that we have here because they're much needed. I could have used a non-judgmental friend to just be there for me for what I didn't know I needed. So thank you for the question. And yeah, thanks for the question.
Thank you. And I think we have time for one last question. So I'm gonna ask a question to Carter, and I'm gonna ask, how did the monthly meetings contribute to the creation of the Pride and Rare program?
Question. So these meetings, when they started out, it was first a place for people to meet each other, to connect, and that was really beneficial in the way that people could share their stories.
Carter, could you speak up a little bit? I think it's hard for folks to hear you. Thank you.
Yes, thank you. So when these meetings started, it was a really great place for people to connect with each other and to start sharing their stories, talking about what they needed. And as the conversations developed, it started becoming clear that we were identifying real gaps in research, gaps in the resources that people really needed as they were navigating healthcare, navigating coming out to family, to friends, to different providers, trying to figure out how to just survive and keep moving with this life. And so being able to hear those stories, to hear what people needed, that has been really helpful for identifying what people's priorities are for the kinds of resources we need to start developing next, and just how important they are to so many people.
Yeah, thank you so much.
I
I
feel
actually
so
have
lucky.
one last question, and this is going to be for Courtney, and this is from the audience. The question is, as a college student who is Black, LGBTQ plus, and has a rare disease, how are you able to find resources and advocate for yourself and others? I'm on a small campus that doesn't have a lot of resources.
Yeah, absolutely. So I put this a little bit in the chat, but I also went to a very small college, and depending where folks live, where they're coming from, there may or may not be more in-person community around you. Together, we are all out there, but sometimes it can be difficult to figure out where people are. To Katrina's point, reaching out at all is always better than staying silent. Online communities are communities, and trying to find the people where you belong and who can help understand you is always better than feeling like you are endlessly stuck alone. So for anyone who's in a similar place and is looking for resources, is struggling with some of those multiple marginalizations and how to navigate that within the rare disease community, please feel free to reach out to me. Obviously, since you are a college student, I'm assuming that you are within our young adult age range. So please feel free to email me. My email is linked in the Q&A. It's also, of course, on our YAR website and under our EveryLife staff page. But as much as possible, just trying to figure out who's doing the kind of work you're interested in. Where are the programs like this? Who is interested in creating programs like this? Where are the Carters leading monthly meetings that help sort of facilitate the setup of a program like this? Those are all good questions to ask, regardless of where you are. There are folks out here for you. That is the main thing I can emphasize. There are folks in your corner. We are also all here together, and we are stronger together.
Thank you so much, Courtney. I would like to thank all of these panelists for being so great and showing the strong community that we already have, that we're getting kicked off, and we're going to get even stronger as we go on. So I'm just so excited to share this space with all of you. Remember that the Pride and Rare survey is now open. Let's fill this gap in research. Let's start. It's going to close on June 28th, so make sure that you fill it out before then. Also, we have Priscilla's email. This is the connection stuff, so please sign up for our newsletter. These are where you can follow us: EveryLife.org, EveryLife Foundation for Rare Disease. So please add us. Let's maintain this community for long after this call. And I would like to thank our Pride and Rare sponsors, which are Amgen, Travair, and Servier. Thank you so much for letting this all be possible. And thank you all for being here. For more information, please contact Priscilla. You can see their email right there. But thank you all for attending this wonderful kickoff and letting us start the Pride and Rare program. We are so happy to have you here and to have you listen and have you share. And I can't wait to be a part of this community with all you. So thank you so much for being here.
All right. Thank you, William, for that wonderful moderation. And thank you to all the panelists. And thank you all for being here today. That concludes our event.